Well, there's a worrisome trend among some kids recovering from COVID. Kids who've had the virus appear to have an increased risk of getting both type 1 and type 2 diabetes. For Your Life, Your Health, Heather Simonson has more on COVID's impact.
At 6 years old,
the butt shot.
Bella Staker can make just about anything fun, even needles.
I'll prick your finger.
Last November, Bella was diagnosed with COVID. A few days later, she was in the emergency room with severe symptoms.
Not being able to wake up, the sweating, the throwing up, not wanting to move.
Doctors diagnosed her with type 1 diabetes, an autoimmune disease that has no cure. It's a life-changing worry for her and for her mom, Brandy.
When she's at school, I have her nurse on my speed dial in case I get an alarm on my phone saying, hey, she's low. I call her because at any point she can go into a seizure if she gets low enough.
According to the CDC, COVID might induce diabetes in some kids and teens. Scientists found kids 18 and younger were more likely to get diabetes 30 days after having COVID than those who didn't get the virus. One data set showed a 2.6 times higher risk, the other a 30% increase. That's consistent with what doctors are seeing at Primary Children's Hospital.
But in 2021, we had about a 25% increase in diabetes, both type 1 and type 2.
Dr. Scott Clemens says he's not surprised by the results.
Type 1 diabetes can often be triggered by environmental factors, such as viruses and other things. COVID could therefore be a trigger.
Type 1 is most common in Utah kids and teens. That's why it's so important to know the symptoms.
Increased thirst, frequent urination, fatigue, weight loss, vomiting, and those are urgent symptoms, and kids need to be evaluated more quickly.
Both the CDC and Dr. Clemens urge parents to get kids 5 and up vaccinated.
And there's a potential that will then prevent some cases of type 1 diabetes.
She has FOMO. In a way, so fear of missing out on everything.
Despite her new diagnosis, Brandy has high hopes for Bella.
But it's something that shouldn't hold her back in life.
Leaving the surprises.
She got glasses, and guess what?
For playtime. For Your Life, Your Health, Heather Simonson.
Nice.
KSL 5 News.
Heather, thank you. Doctors say both type 1 and type 2 diabetes are increasing rapidly right here in Utah. Along with getting vaccinated, the risk of type 2 diabetes can be decreased by following healthy lifestyles. For more information, visit the story on KSLTV.com.